Congress appropriated $8.3 billion in emergency spending in a coronavirus funding bill, and that was signed into law by President Trump. The bill included vaccine development, supplies, support for community health centers, and support for state and local health departments. What wasn't clear in the bill was the coverage piece, how people can go get testing and treatment and have that be a covered service across the board. But that's now the role that some state and local officials can try to proactively take on. What a lot of public health officials are rightly saying is that if you think you need care, go to the doctor. If you have symptoms, go to the doctor. Then let's help those local health officials and local mayors and local governors try to get the support they need so they can figure out the healthcare financing piece. What usually happens in scenarios like this, and we've had a couple instances in history, is that the financing piece is very reactive. It's not proactive. Here are a couple examples. After 9/11, there was a Medicaid relief program that became active in New York that allowed for faster enrollment in Medicaid for anybody that might have been exposed during the very tragic terrorist attack. There was an expansion of Medicaid after Hurricane Katrina that allowed temporary coverage for individuals that had to evacuate the New Orleans area to other states and enroll in that other state Medicaid program, even if they otherwise might not have been eligible because of that residency requirement. And we saw other instances in other scenarios where Medicaid expansion helped pick up the pieces after a disaster. There are states that expanded Medicaid already and are better prepared for something like coronavirus. The states that didn't expand Medicaid are now behind the eight ball, and they're trying to be a little bit more reactive instead of proactive. Here's the advice to local governors and legislatures is expand Medicaid so you can be prepared should the situation change at any moment in your state. And also, if you haven't already made it easier for folks to get to the doctor, to get their services paid for, facing what could become a bigger epidemic, take the time to do that now so your state can be ready to pivot and address the testing and the treatment needs of the people in your community. We know from history it's been helpful. We know now is the time to act so you're being more proactive and not reactive after people's symptoms become acute.